man from Castle Hill. Pleasingly, none of his close contacts to date have tested positive, but through an abundance of caution, we are including that in today's numbers. Now, since 8 p.m. last night, we have had one additional case. This is a gentleman in his 50s who attended Maya at Bondi Junction, Westfield. For that reason, I want everybody, obviously in the eastern suburbs, to remain. Dr. Chant will explain the details, but it appears from CCTV cameras that it could have been a very fleeting contact between the infectious person and this gentleman in Bondi Junction, Westfield. The other important point we want to make this morning is that Health currently is going through all of their venues. They may deem close contact this morning. So please make sure that if you've attended any of those venues, that you look at the Health website consistently, so that if Health has updated their venue from a casual contact to a close contact, that you immediately isolate for 14 days. In relation to what we're recommending people do in the next few days, we want everybody in Greater Sydney, and for the purposes of this particular outbreak or number of cases, we are excluding, so not including the Central Coast, the Illawarra or Wollongong. So when we say Greater Sydney, we're sticking to the literal geographic definition of Greater Sydney. For the next 5 days, we want it to be compulsory for everybody to wear masks on public transport to make sure that if the virus is circulating, that it doesn't spread on public transport. In relation to people who are currently deemed to be casual contacts, so if you attended a venue which is on the Health list, we strongly recommend that you don't go away anywhere, because if Health updates that to a close contact, you'll have to come back and isolate. So we're strongly recommending that if you are a casual contact, that you not travel in the next little while, and make sure you follow the Health advice in relation to the venue that you visited. In relation to mask wearing, we're recommending that in all indoor venues in Greater Sydney, and again, that you wear a mask, whether it's a cinema or whether you're shopping or whether you're a hospitality frontline worker. Now, it's not compulsory, but we are strongly recommending that, especially if you can't guarantee, especially in those places around the eastern suburbs. We know the virus has the potential to have been circulating in eastern Sydney in particular. So again, we send out a message to say, unless you absolutely have to, our strong preference is that you do not engage in any activity unless you absolutely have to, especially in those eastern suburbs communities, especially in proximity to the venues that have already been identified. Also, we just want everybody, no matter where you live in Sydney, to make sure that you're hand sanitising, you have good social distancing, that you're QR code checking, and thank you to everybody who's been doing that. The venues that we've been involved in have been outstanding, but obviously in a shopping centre like Bondi Junction, people may check in at one venue but not all the venues, so please make sure that you are constantly looking at the Health website for those details and that information. So as we've done in the past, the New South Wales Government, based on the expert health advice, has relied on our community to step up and do what we've asked them to do. So we're really making sure that everybody follows this. If you are planning to go to an organised event, those events should proceed, because all major events, all outdoor events, all events have good COVID safety plans. So we don't want anyone to cancel any events. We don't want anyone to cancel any of those organised ticketed events in particular. Just make sure that whether you're the organiser of the event or you're someone attending, that you stick to those recommendations we've given you and stick to the good COVID safety plans. Those safety plans have worked for us in New South Wales. We don't want people panicking, but at the same time, we want everybody to be on high alert. We want everybody to appreciate that if all of us do the right thing, we're able to get through the next few days without imposing any further requirements on our population. So our intention is that what we have announced today will get us through the next few days, unless there's unexpected things that come up. But obviously we're closely monitoring the situation. We want everybody, as they've done in the past, the New South Wales way, to follow our advice, to be sensible, not to cut corners, and to appreciate that when all of us do the right thing, we keep all of us safe and we're able to keep everything open. So Dr. Chant will now give an update on the health situation, and then today we have Superintendent Holland from the New South Wales Police Force to give us an update on their investigations, but also reinforce the message around compliance. Police and our regulatory bodies will make sure that venues, individuals are doing the right thing the next few days in particular, and to see us through. But I'm just urging all of our citizens to do what you do best. And one other point I'd like to make is if you are travelling into Sydney from other regions, you will have to obviously conform to what we've asked people to do. So if you're catching public transport in Sydney, if you're here the next few days, make sure you're wearing a mask. If you're going to an indoor event, make sure, our strong recommendation is you wear a mask. Make sure if you're going to an event, whether it's a sporting event or anything else, that you follow the safety plan of that event, and make sure that you check in particular to all of those venues. Again, our intention is that this is where this is how we lead our way through this current number of cases. But if there's anything unexpected that occurs, if situation changes, of course we'll have to come back and ask the community to do more. So I'll now ask Dr. Chant to give her update, and then Superintendent Holland, and then we'll take any of your questions.
Thank you, Premier. So the Premier's indicated our testing numbers, and it's pleasing that there was some increase in testing overnight, but we do need the community to respond for testing. Overnight, a new case of COVID was notified in a resident of Bondi, and this person shopped at the Maya Bondi Junction on Saturday the 12th, June 12th, at the same time as the initial infectious case in this cluster, the limousine driver. The new case had onset of symptoms on June 15th and is considered infectious from June 13th. So while infectious, this latest case visited venues in Redfern, Newtown, Bondi Junction and Campbelltown, and travelled on train from Newtown to Bondi Junction on June 13th and from Bondi Junction to Campbelltown and return on June 15th. The exact times and locations will shortly be posted on the New South Wales Health website. Rapid testing overnight has showed this person's household contacts are not currently infected, but they will now quarantine for 14 days. What's important is we are concerned that people may not have been aware of their exposure, particularly not conscious that they've visited Maya at Westfields or been to those venues at Westfields. We know that people do go to shopping centres and you may be not conscious. So please be particularly aware of your movements on the days. Check the website. But we also know that people have to move, whilst people might recall what shops they visited, they clearly move around the Westfield shopping centre when they're doing that. And so again, we can't exclude that someone has had intermittent contact with that person. And so again, being very vigilant if you've been in that precinct or any venues or passing venues that have been listed. The whole genome sequencing has confirmed that the case reported yesterday, the patron of the Bell Cafe at Vaucluse, is an exact match to the initial case. Now that's expected, but this indicates that the initial case was highly infectious, as transmission must have occurred through fleeting exposure, noting that the woman who caught the infection at the cafe was actually seated outside and there was no known contact with the initial case. Now obviously we can't rule out that there was some crossover when they were ordering or other things, but again we're just highlighting that we have observed these transmissions in settings where we would normally see outdoor dining as a lower risk setting, and we would normally see shopping centres as a lower risk setting where you're unlikely to have close contact. So this just highlights that we need that extra vigilance in the community. So given the emerging evidence of the initial case's highly infectious status, today New South Wales Health will review all of his other exposure sites and may upgrade several from casual to close contact venues. And I did flag that yesterday with you that we'll continually review. So anyone at the Maya Bondi Junction level 2 or 4 between 11:15 to 11:50, or the David Jones Bondi Junction level 1 between 10:55 to 11:15 on June 12, it is now considered a close contact and must get tested and quarantined until June 26th. Patrons of Westfield Bondi Junction Food Court level 5 on June 13 from 1:15 to 1:45 are now considered casual contacts and should get tested and isolated until a negative result is received. And if you have been to any of the sites visited by any cases, please monitor the New South Wales Health website for updates to the directions, and isolate and get tested if you develop any symptoms. So again, can I thank this gentleman for coming forward? I believe that he initially was not aware he was at a venue, and that's why of concern. And I just want to again highlight the importance of going back over your movements, check your receipts and your bills, check your movements, and please follow the public health action. In relation to the other case that we reported yesterday, an expert panel, so that was the case related to the gentleman in Western Sydney, in Castle Hill area. We were unable to conclude that that person was a false positive or an old infection. His results of his serology did not help us because they were negative. His repeat testing was negative, indicating that at that point in time he wasn't very infectious or infectious, but what we can't preclude is that he was infectious prior to that time. He will be undertaking further testing, but for the abundance of caution, we need to act as if that he was infectious, and we have issued text messages and contact tracing initiated yesterday. Pleasingly, his household contacts were negative. So I'll leave it there, and thank you.
Thank you, Premier. Minister, Dr. Chan. As outlined yesterday by Deputy Commissioner Warboys, the police hotel quarantine program is robust, flexible and continually evolving. This program puts the safety of the community and returning travellers, and obviously our frontline workers, make sure they are safe all the time when they return. Our major concern at the moment is the limousine driver who has been investigated by police. Police have spoken with that gentleman. He has been very forthcoming in his information. That investigation is ongoing. More importantly, he's given information to health, which we continually make sure we identify locations and any contact concerns. As the Premier mentioned before, mask wearing will become compulsory in the next few days. Police will be looking to the community to make sure there is compliance in those areas. We would rather be compliant with the community rather than enforcement. Thank you.
I don't think we did get the testing.
Oh, sorry, apologies. So there were 21,678 tests were reported to 8 p.m. last night, compared to the previous day's total of 23,145. So it's good that we've maintained our testing, but we do want to see a real ramp up in testing.
Dr. Chen, was the person infected on I'm not sure of the days, I can't remember. What day was that? Was that?
I think it was I'll just double check. I think I read out that it was the 12th or the
12th. Is that the same day as the person was infected at the cafe as well? So
I think that I have to double check, but that was either the 12th or the 13th. Yeah.
So those 2 dates seem to be.
So he's clearly infectious because he's been able to manage to transmit to a household contact, which is what we would predict. But what we want to do in assessing the risk of his infectiousness is does he transmit in other settings? We have clear evidence that he's transmitted in the cafe setting, and that would have been remote contact because the gentleman does not, she does not recall being in contact with him. And also the fact that this Maya, we are reviewing CCTV footage. Can I thank the gentleman who, again, the limousine driver who's allowed us to have a picture of him, which facilitates our investigation. So the public's cooperation in getting tested and also their cooperations with the public health interviews has been most pleasing.
You said fleeting interaction. What does the video show?
Well, at the moment, they know that they've placed him on the same floor in the same section of Maya. They've just asked for further CCTV footage to track his movements to see if there's just inadvertent passing. So at the moment, we don't know the nature of the contact, but the fact that I think the community would understand that in general, when we're shopping in settings such as those sort of retail environments, we don't generally come in close proximity. So we just need to wait for the CT footage. It's difficult to absolutely recall everything that happens, and there might have been a closer exposure just by coincidence in terms of the nature of what they were doing.
Together. We don't see them photographed.
We have All we've confirmed at the moment, this case came in last night, and we thank the cooperation of getting the CCTV footage. What we know is the check-in times that they've checked in were close. That led us to ask for the CCTV footage, and we've shown that they're in the same section at the same time. What we're looking at is different angles to watch how they're moving around to see if there is a more direct exposure.
So is it more likely that perhaps the infectious man has touched something?
No, I think it's too premature to say that. Let's wait for the CCTV footage. The main point we're trying to say is that we know the Delta strain, and that's the strain we're dealing with, is more transmissible. And therefore it is important that we take these extra precautions of upgrading venues when we see transmission. We also know that there's an individual factor for transmission. So some people with Delta strain don't transmit further, but we have evidence that this gentleman did transmit. So clearly he's one of those people that are able to transmit, and in settings where we wouldn't see them usually being the highest risk settings. And because of that, that's making us act even more precautionary. But as I said, we're also conscious that the community needs to respond to the testing. Anyone with symptoms, and this gentleman had symptoms, and the call out did prompt him to attend for testing. And again, we're concerned that people may not have thought about what they did on the weekend and really considered whether they were in any of those shops. And I am asking everyone who's been in that Bondi Junction shopping centre around those times, please be particularly cautious.
Do we have any indication of how long the limousine driver was working without getting daily swabs?
No, look, I think our focus has been really very clear to focus on the public health aspects of the investigation. I would see that would be a matter for police to look at those aspects. It's really important that we have the cooperation of individuals, and we very much separate those roles. And can I thank everyone for their cooperation? It is essential.
The exposure sites, Premier or Dr. Champ, they're growing, aren't they? We're now reaching into Campbelltown. Is it an unfolding mess we've got at the moment?
Oh, look, I think this shows the nature of the virus, and we've known that from day one. But can I also take this opportunity, which I should have done at the beginning, to thank the outstanding work of our contact tracers. I mean, within hours, to be able to work out where the additional case and cases from yesterday actually crossed over within literally hours is just outstanding. And I think it shows the type of robustness in the system we have. It's far from perfect, no system is, but it is evolving. I'm not going to pretend we're not concerned about what might happen in the next few days, but we feel at this stage what we've asked the public to do is proportionate to the risk, given the robustness in the contact tracing, given the number of people coming forward and getting tested, and also given the fact that the eastern suburbs community has been through this before. But we do say that given people have been on public transport, given we know one case in particular has transmitted the disease in a very fleeting way, we're asking everybody to be on high alert, not to engage in activity you otherwise don't have to do. Just don't expose yourself or your loved ones to any risk. But also, at the same time, know that if you're going to an organised event, the COVID safety plans are there for a reason. So please respect the QR codes, please respect what the organisers ask you to do. And if I was going to an event or going to an indoor event, I'd be wearing a mask. We're not saying you have to, but if you're going to a cinema, for example, where you'll be there for a couple of hours, you should be wearing a mask. Oh, because at this stage, if the situation changed, we'd be able to escalate. But given that the number of cases we've identified has those links, has the crossover points, and given that those people who have been those close contacts are in isolation already, it reduces the risk. New South Wales learns every time we have an outbreak, we take what we learn to the next one, and we try not to burden our citizens or our businesses unless we absolutely have to. So we feel the response we've outlined today is enough for what the information we have today. But if that changes, which is always the case, we we have room to move. We don't want to move at this stage, but we have room to move if the situation worsens or something unexpected happens. But what we do definitely want people to do is, if you're catching public transport, please, it's compulsory. That is the only thing that's compulsory between now and Wednesday night. Please make sure if you're catching public transport, you're wearing a mask. We're doing that from 4 o'clock today. I know some people might already be at work. It doesn't take much to get a mask. Please make sure you do that, and please make sure you follow the other advice we've given you this morning, especially in and around the eastern suburbs. I'd rather us be cautious the next few days and not attend events and venues in that region rather than have to go further with restrictions more broadly.
What's your message to the other state premiers? Obviously they're holding on the borders at the moment, but they might move today.
Well, firstly, I say thank you. The restraint shown is better than what we've experienced in the past. And so firstly, I say thank you where thank you is the case. Please watch New South Wales and what the other states are doing at the moment is what I would do, which is reciprocal arrangement. So obviously if someone's visited a venue which is of concern, if someone's deemed to be a casual contact, well then of course you've got to go through those declarations. We're recommending anybody who's a casual contact not to go anywhere, frankly, because health might very well in the next few hours say you're a close contact, and we don't want you and your family and loved ones disappointed because you've exposed all these other people, and then not only yourself but all the people you've come into contact with will have to spend 2 weeks at home. We don't want people to have to go through that. So if you are a casual contact, please don't go anywhere, cancel your plans. That's just an extra precaution to make sure that you don't inadvertently cause harm to yourself or anybody else.
Premier, what is the threshold? If we continue having 1 or 2 cases a day for the next week or so, at what point, what triggers the inclusion of more?
Yeah, well, obviously it's an evolving situation, and what New South Wales has learned in the pandemic is no number of cases or clusters are exactly the same. There's always evolving issues. What I do know is that our contact tracers, as good as they are getting even better. Because to have, some example of CCTV coverage within hours of having a case, literally, the case that emerged this morning, was confirmed this morning, and already we've got the crossover point. That's really great work. Thank you. Dr. Chant, can you personally thank whomever it was that made that? But clearly, we know the systems are there. And that gives us some degree of ability to react the way we have, but it is evolving, and I think the public gets that. If suddenly there's a number of cases that emerge which we didn't expect from unlinked sources, well then that will cause us concern and we'll have to go further. At this stage, we feel what we've done and said is enough, and the public does respond. You notice as you're moving around that public, everyone self-regulates, which is exactly where we want to be, because we have to get to a place where we start. COVID normal is a difficult description, but we have to get to a stage where we all learn to live with this. We are going to get cases popping up. We've got Aussies coming home every week through Sydney Airport. We know the risks are there. The risk is always going to be there, but it's how we respond to the risk and how we respond to cases that really is a measure of our ability to live a life.
This is a scary example of Delta, because with the barbecue man, he had Delta and he did not pass it on to anyone.
It's scary, and Dr. Chant always advises myself and the Minister that some people are just bigger spreaders than others, and it's random. We know the virus is extremely contagious. We know that a fleeting passing, as has been evidenced in the 2 cases, a fleeting passing is all it takes. Some people for some reason aren't contagious, and some people are extremely contagious. And the randomness of that is what makes it scary, which is why all of us have to be on high alert. So every time now, until the next 5 days in particular, every time any of us leave our home, we have to assume we have the virus or the people we're coming in contact with have the virus. That's why keep your social distance, wear a mask if you can't guarantee your social distancing, hand sanitise, be careful around vulnerable people, and of course health will put in those special measures around health facilities and aged care facilities as well as a precaution, as they do. Health managed venues always go that extra step, as you understand. So we know the drill, but it is evolving. So if anything unexpected happens that gives us concern, we will move. But at this stage, what we've announced this morning, we feel is adequate for the risk that we're seeing.
The superintendent said the limousine driver is cooperating, so presumably you are now across the circumstances that might have led to that. Can we be confident that whatever may have happened there is not happening still at Sydney and South Wales?
Well, certainly we have very strict rules and guidelines in place for our system. We always want to wait till we get the facts, and once police complete their investigations and provide the advice to all of us, we'll be able to explain what our response is to that, whether it's a compliance issue, whether it's a broader issue, and they're things that we're happy to look at. But New South Wales is never afraid of responding to a situation that arises. We're never afraid of making sure we respond to keep our community safe. We've been very open about that. Often the Minister, Dr. Chant, and I will give you detail that is over informative to make sure that everybody knows exactly where things are at. I don't mind that at all. We'll cop whatever we need to do to make sure we keep the community safe.
Premier, in regards to the vaccine, in the United States this week we have seen certain states like New York and California setting targets of how many people need to get the vaccine before we stop having restrictions regardless of cases. Why can't we set that in New South Wales to encourage people to come forward?
I actually did it about 2 months ago. I actually said I'd like to see us get 10 million jabs before we have a conversation about what happens next. So I actually went out on a limb and gave that figure as a target. Is that
in concrete, or is that something that you would...
Well, it's a target, and it's based on the advice I've had that you can't really consider COVID normality until at least 80% of your adult population. The experts range from, Dr. Chant, if I'm saying anything wrong, will you interrupt? No. But the experts say, depending on the expert, anywhere between 70 and 80% of the adult population should be vaccinated before you have those conversations. So that's why I've been super vigilant in trying to get as many jabs in arms as possible. One thing I can't control as the Premier, I can't control the doses of vaccine we get, and I can't control the vaccines we get. But what I can do is provide information to our communities about where you can access the jab once we actually get it in New South Wales. I can't control that. As you know, that's another government's responsibility. But what I can do, and what we can do collectively, is really encourage everybody who has access to the vaccine to get it. We will make sure we use up every single dose we get. We do have a sense of urgency in New South Wales. I think we need to be far more ambitious in how quickly we vaccinate our population, in how quickly we think about opening up, and how quickly we think about COVID normal, because otherwise we will get left behind.
Dr. Chair, may I just ask you quickly, is it Castle Hills or Balcombe Hills?
He actually lives in Balcombe Hills, but again, it's not really around the suburb. Can I just be very clear that although people live in suburbs, it's really about where they've been and their activities. So we want to make sure we protect people's privacy. But yes, he did at Balcombe Hills, as I understand.
On him, obviously, we can't link him to this current case, so that's of great concern. If we have one that's come out of nowhere that's not linked, there were some sewage surveillance, I think, in that area.
He doesn't actually live in the area where the sewage surveillance. So that's, again, cross triangulation. We've also had some positive detects in some of the sewage, which is reported in Camellia Grove. And again, we've had quarantine people released into that area, but for the abundance of caution, we use our sewage surveillance to give the community that information, and we ask people to be vigilant for signs and symptoms. But at this moment, I'm really asking anyone with any symptoms to get a test. Obviously, we're concerned, but what we're interested in is whether a person has transmitted. So the first group that you're most likely to transmit to is your household contacts, then it's your close friends, and then it's your work colleagues, and then people that you've potentially had hospitality settings or anything that you've had parties or other gatherings. So with this gentleman, we should be able to, notwithstanding further tests, which will perhaps help us rule out that this is a true positive, we may never know for certain. And obviously there is always some scientific uncertainty, but we have to act in a precautionary way. But we will build up a picture quite quickly, because if this person was infectious a little while ago and has managed not to transmit to anyone around him, that gives us comfort that that doesn't provide that does not pose a threat to us. So we have got to keep an open mind. We've got to be watchful about that case. We are doing some upstream investigations. But for me now, given his timing and his results, so the first test showed very, very low levels of virus present. So he was probably uninfectious the day he had that test, and he actually has an alternate virus that explains some of his symptoms, okay? So what we can't rule out is that a little while ago he was infectious, and then he's become non-infectious. So that's the issue with him. Can I just explain the thinking? And I suppose at the time we discussed and I'll call him the Eastern Suburbs gentleman rather than barbecue man, but that gentleman.
You know what I'm
Yes. The concern for us then was the fact that that was an unlinked cake. There was missing links. So we knew that his sequence matched to an overseas person who's returned, but we could find no plausible link between that person and how he got it, despite intensive, investigations. So that meant that someone must have been an intermediary if there was a direct exposure. So what we were concerned about is that unknown person and where that unknown person had been. And we knew that we were dealing with the Delta strain. So those factors meant that we moved with the mask wearing in the indoor and the precautions. Now, as I said, every case is separate. The things we're looking at particularly are the nature of not the direct exposure. So the fact that this lady yesterday associated with the cafe exposure was positive. What was pleasing was her next ring of close contacts were negative. If we see those next rings becoming positive before we get to them, that raises a concern because it means that we're chasing our tail. And that's an indicator of risk. And if we see unlinked cases that we're concerned about. And obviously my concern level has gone up a little bit today because of the fact that I'm aware that transmissions occurred in a shopping centre, most likely to have occurred in a shopping centre. And I understand that people may not have all religiously checked in, people may not be conscious that you went shopping or even conscious which settings, and that's why I'm asking for particular vigilance. People know that they use Bondi Junction as a shopping centre. Please just be particularly vigilant.
Last few questions, please.
Are we aware of how many people will now have to go into isolation for 2 weeks? Is it hundreds? Is it thousands?
It's already well over 100. As I said, but we haven't got the exact, with this upgrade, this has just literally been the risk assessment that's been updated today. We'll be able to give you some updated figures. I'd also like to just stress and echo the Premier's words just around aged care facilities and hospitals. We are asking you to just obviously if you've been at any casual venues or close contact venues, we ask you cannot go to aged care facilities or visit patients in hospitals unless there's a risk assessment done. Obviously we do want to mitigate any harms if you're involved in end-of-life care or other unique circumstances. And we're also introducing mask wearing for visitors into aged care. So we do those routine things we do to keep aged care particularly safe, and we ask the community's cooperation in that regard.
Do you think that we're getting enough vaccines, and how frustrating is it to have the rollout in your state dependent on the federal government?
Oh, look, that's the nature of the Federation. That's the nature of the rules that exist. And if we had more vaccines, we'd get them into jabs more quickly. That's the bottom line. But I've had a sense of urgency about New South Wales citizens having access to a vaccine. I pushed to make sure we made it accessible to key workers. I pushed to make sure that New South Wales Health could step up and help with the rollout. Can I stress how grateful we are to the GP network? The GP network needs more doses and is craving more doses, and we rely on them to really get the doses, the jabs in arms. And of course, New South Wales Health is breaking records every week on how many we're managing to do as well. But we are limited by the doses we get, and that's something I can't control. But we're looking forward to getting more doses in the next few weeks, which is the advice we've received from the Commonwealth.
To the inquiry yesterday, there seemed to be a sense of blame over him potentially not getting daily swabs or not wearing a mask. Is it fair to be blaming him for that, or should he have been checked?
We're not casting any aspersions until the police report's completed, and that's what we have to do. There's no point dealing in speculation. In a pandemic, when you deal with speculation, you get in trouble. What we do is deal with the facts. So as soon as we get an update from police as to what did or didn't happen, what should or shouldn't have happened, we'll react accordingly.
Do you worry with the police investigation that this will stop people from coming forward if they're scared they'll be
Well,
investigated by
no,
police?
but that's why we've been thankful that the gentleman has been so cooperative with health, so cooperative with police. We're deeply grateful because under these circumstances, and that's why New South Wales has the policies we do, our biggest issue is to have people just tell us everything they remember. And just imagine if any of us had to think about what we've done in the last 2 weeks or the last week. It'd be really hard. We'd think about things, you know, subsequently. You'd think you've done this and that, and, oh, by the way, I picked up this or dropped this off or jumped into this shop. So we're relying on people's goodwill, and can I just thank everybody for their goodwill? And that's why it's really important not to prematurely cast aspersions until we know the facts. And we're a government that's not afraid of the facts. The facts are our best weapon to deal with the pandemic moving forward. And once we get the facts, we'll be able to explain what happened and what if any, response there is.
Reports
Are the
from
gaps in the system with the driver related to the hotel quarantine?
Last question,
system? What
please.
are the gaps that you're addressing? or looking
Well, we don't know yet. That's why we've asked police to investigate.
Can I ask one off Broadway? An overseas manufacturing report today shows the economic benefits of keeping some transport contracts here have outweighed the savings of sending them overseas. Do you still maintain New South Wales is not very good at building trains?
New South Wales is outstanding at a whole range of things. I'd love for us to be first in the world in everything. But we are the only state in Australia, and I would argue perhaps the only place in the world where we haven't lost a single day of building projects. That's jobs. I'm so proud of the fact that we've kept people in jobs, we've kept the infrastructure pipeline going, and the private sector has had confidence to come in off the back of that and keep building as well. So I say to anybody criticising the New South Wales government, we are the only government in Australia that hasn't lost a single day in construction. Even during so-called lockdown that we had, we kept our construction sites going. We are building, creating jobs, tens of thousands of jobs every week. Primary jobs are due to our infrastructure pipeline. That doesn't even consider the secondary and tertiary supply chains, which we're also providing employment for. And only this week, we announced $1 billion of taxpayer dollars going towards building a brand new city, which will have the best advanced manufacturing in the world. We will be building and creating new generation robotics, logistics, cyber, a whole range of jobs that don't exist anywhere in Australia. And New South Wales will be the capital of that. So I'm happy for people to put those issues to me and to our government, and I'll respond in those terms. Our whole way in managing the pandemic has been about keeping everybody safe and healthy, but also keeping those vital jobs going and allowing us to use this opportunity to really put us on the map into the future, to make sure that we are the advanced manufacturing capital of the world. Some of the technologies which are now being put to us are old school. We're about all the existing technologies and building on them for the future. And I'm really encouraged by the breakthroughs we'll have in New South Wales because of this sense of confidence, enthusiasm and pride we have in our state.
Thank you all. Last one, please.
Just on, slightly aside from the man who may have broken the rules, but obviously they are your health orders. Are we confident that there are no other private contractors that are operating in our quarantine system that are potentially not doing the right thing?
No system's perfect, and the one thing we do know is this virus, this COVID virus is like a guerrilla fighter. It comes out when you least expect it, which is why we need to do all the things that we've been doing for the last 15 months. QR codes are the weapon that we have to fight back with, and I would just strongly encourage people to actually use the QR codes no matter where they are. As to the system, our system has had 190,000 people come through our hotel quarantine system. We have 6,500 workers every week working on our hotel quarantine system. We do everything possible to make sure it is as safe as possible. We've had a handful of cases over that last 16 months. And every day we go to work, we make sure that we're doing everything possible to make sure it stays safe. Is it possible to absolutely guarantee that nothing can go wrong? Of course not. It's a human system. People are actually coming in and out with the system the whole time. So we'll do our best and we'll continue to do our best. But at the end of the day, it is about the community being with us on the journey. And as the Premier said, the Premier has emphasised on many occasions, and so have I, we are very lucky that our community in New South Wales listens to the Premier, myself and Dr. Chant and responds appropriately. And I'm sure that all of those frontline workers will do the same. Thank you very much, everybody. Thank you.